Dear friends, on behalf of the Board of Directors of Thalassemia International Federation, I want to give this message to all our people, our thalassemics. We are going through a very difficult time. The new developments with this virus is quite dangerous, and Thalassemia International Federation is taking things very serious. We are developing policies, we are developing instructions and leaflets. We kindly ask you to look after yourselves, follow the instructions of the Thalassemia International Federation, follow the instructions of your doctors. We have to be very careful and very consistent in protecting ourselves from this dangerous and difficult virus. Please look after yourselves. Please look after the people that are around you. It is a very important period that we are going through.
Dear friends, during these tough times brought on humanity by the evolving coronavirus pandemic, Thalassemia International Federation remains committed and very focused to serving the global thalassemia and sickle cell community. We are currently focusing on monitoring the situation and spreading reliably information and useful information to patients, but also healthcare professionals worldwide, as well as to the community at large. To this end, and with the invaluable contribution of TIF's International Advisory Panel members, TIF has developed a significant number of informational materials placing particular emphasis on the coronavirus in relation to hemoglobin disorders, such as the COVID-19 pandemic and hemoglobin disorders leaflet, which has already been translated in multiple languages and is available on our website. The TIF proposed hemoglobinopathy patients' pathway during the COVID-19 pandemic, which is a guide for safeguarding the environment where patients are being transfused, a health and nutritional short guide, as well as several other interesting resources that can be found on TIF's website. In addition, particular efforts are being made in ensuring the continuation of blood donations to avoid blood shortage, as very sadly this pandemic is keeping people from donating blood. In an attempt to thoroughly inform you about this special material and help disseminate it as widely as possible to all interested parts, we invite you to participate in a series of webinars that we are going to schedule for next week in different time zones. So in closing, I would like to wish all the best in this pandemic that we're all facing, and that TIF remains committed to support you in as many ways as possible.
A few words from me, a few words of advice to all our thalassemia patients, wherever they may be. We must keep ourselves safe, and one of the first elements of safety is to keep our thalassemia condition under control. Good blood transfusion, good iron chelation. Why? Because it is supposed that a well-controlled thalassemia patient may not have an increased risk for complications as compared to the general population. However, as complications increase, like heart complications, like diabetes, so does the risk of the coronavirus infection increasing to a more serious clinical entity. Therefore, while we are safe, we keep ourselves safe by keeping our treatment keeping ourselves in good condition. The next thing, however, is the recognition that a thalassemia patient has to visit hospitals and thalassemia centers and transfusion centers regularly every month, and therefore is at increased risk of contacting with people that are already infected, or even, if carrying the disorder, infecting other people themselves. What must we do, therefore? TIF has developed a patient pathway. This includes not going to the center before phoning in, before discussing this with the healthcare team. When will blood be ready? Going there when the blood transfusion is already readily available. Going in for tests when we should. But in approaching the thalassemia center, we go through a period of triage, of assessment of our clinical conditions. Temperature is taken, history is taken, contacts are written down, and then if there is any danger, we go to an isolation room and not mix up with and not mix with other patients. So, following TIF guidelines, TIF pathways, and the general prevention measures that are mentioned for the whole population, hand washing and all the rest, all these must be kept religiously by thalassemia patients in order to keep safe. Thank you.